Well, Dr. Teymorian is here today, and good to have you. Always nice to see you.
Well, thanks for having me on. It's always great to be part of the show.
We're going to talk about new exciting therapies for glaucoma. We're going to put up some slides here. The first thing is explain glaucoma and how widespread is it? I think many people would want to know, what are their chances of getting it and why?
Yeah. Currently in the U.S., it's estimated that there's 3 million people with glaucoma.
Okay.
The unfortunate part of it is there's an estimated value, about 50% of them don't know they even have it, because it's really the silent thief of glaucoma. Okay. What's happening here in glaucoma is, I want you to imagine the eye. It's a lot like a faucet and drain at your house. Mm-hmm. There's a fluid on the inside of the eye that's created, and you need this fluid. That's what nourishes the tissues on the inside of the eye.
Right.
This fluid then needs to exit the eye. For people who have glaucoma, there's an imbalance here. There's too much fluid being made or not enough fluid being exited. What that creates is higher pressures in the eye. The unfortunate part is it's the very sensitive nerve, the optic nerve in the back of the eye, that feels this excess pressure. I want you to think of the optic nerve a lot like your cable cord at home for your TV. It's created by a lot of different little fibers. When the eye pressure is high, it damages each of these fibers. It's almost like losing a channel every time the pressure is high.
Okay.
Well, ultimately, if the pressure is high for a long time, you lose all the channels, or in this case, you lose your vision.
Okay. So obviously, the first step is finding out if you have it at the early stages. And of course, that would happen when someone comes and sees someone like yourself for a typical eye exam.
Yeah, a normal eye exam, there should be an evaluation of the optic nerve, which is what we talked about, checking the eye pressure, and a couple of other ancillary tests that'll let us figure out if you do have glaucoma or if you're at risk for glaucoma. And that's really the most important time to be diagnosed and treated, because we want to treat patients when they're not noticing visual symptoms. And we sort of have a buffer zone of which we can do that. The trouble we run into is when people aren't seen with regular eye exams and they come in when they're noticing something is wrong. At that point, unfortunately, it's already advanced glaucoma, and that's very difficult to treat.
Okay, so let's talk about treating it after you, hopefully, someone came in and it got spotted early. So I see a couple different techniques here.
The mainstay of therapy for glaucoma is to reduce the pressure of the eye, and we have 3 options to do that. We have eye drops, laser procedures, and surgical procedures, and that's an increasing order of risk to the patient.
Okay.
The difficulty with the surgery is there's a lot of risk that's involved, and we prefer not to do them. We'd like to stay on the more conservative route with eye drops, and I think most patients appreciate that kind of an approach. The difficulty with the eye drops is most people require more than 1 drop, at least 2 drops, and then these drops need to be administered multiple times a day. So if you can imagine, to take care of glaucoma, which is just one disease that most patients have, patients mostly have other diseases too, they have to administer many drops during the day. The other issue is each of these drops that we showed here on the screen work in one specific way within the eye. Just like we talked about, some of them will make less fluid, some of them will help the fluid exit. What we're really looking for are better solutions. How can we find a medicine that can do all of these things together without having to require so many drops? And you can only imagine if you have a patient that's on 2 or 3 different types of medicine, and each one needs to be administered a couple of times a day, that could be 8 or 9 drops a day. And you ask a healthy 18-year-old with nothing else to do, try to administer all those drops at the right time, they would have a difficult time. Now when you add it to an older patient that has other things going on, it makes it almost difficult to, almost impossible to do.
I would think so. So what are some of the things that are coming up as far as these new treatments? You mentioned laser treatment.
There's a laser treatment that is available that does help out, and there also are neurosurgical interventions. But what's the most exciting thing is there's new things coming out in terms of eye drops that are being created. And I'm not sure if our audience knows, but actually Orange County is the ophthalmic hub for not just the United States, but for the entire world. There's many different companies that are involved in surgical instruments and devices, and also actual eye drops that could be administered. One of the fortunate things here with our group, we're a larger group with a very good reputation. These companies typically reach out to us to see if there's any way we can work with them to provide medicines that wouldn't be provided otherwise. One of the newer medications that are coming out is a particular eye drop that doesn't just have one mechanism of action, meaning one way of working to help with this disbalance. It actually has 3 or 4 different ways of doing it. So it takes all those different medicines that I showed before, the way they work, and combines them into one. And that's where it gets really, really exciting, because our patients are always asking, gosh, I know I need these medicines, but isn't there a simpler way of doing it? And I think we're on the verge of doing that. And this would really change the way we practice glaucoma management.
I have a question. When I think of eye drops, obviously, you know, you and the other doctors at Harvard Eye have talked about these before for many different things, eye irritation, lack of tears, that sort of thing. I understand that. I understand how that works. But when it comes to drops to reduce or at least balance out pressure inside the eye, when to me these drops are going on the outside, it's hard for me to grasp how they work.
That's a great question. So the front surface of the eye, the cornea, although that's a protective layer, the medicine that gets absorbed through the cornea can actually go through it and get into the eye. If you look at the eye, you'll notice it's the one area of the body that can't have blood vessels. You have to be able to see through the material to see what you're seeing.
Yeah.
That's why having the fluid that's created in the eye is very important. You can't just simply have blood supply to these areas. It has to be a clear medium for you to look through. And that's where the fluid, it's not just a fluid, it's a nutrient-rich fluid that exists in the eye. So the medicine gets absorbed and actually gets into the eye.
Okay, so these new advances in the drops, would they eliminate putting them in several times a day? Is that the biggest issue?
The big issue
And
is,
maybe taking 2 or 3.
yeah, the big issue is we want to increase the quality of life for our patients.
Okay.
And the best way to do that is to be as minimally invasive to our patients. Think of it like a referee at a sporting event. You want them to do their job without being noticed. And that's what we kind of want to do. So the best way we figure that out is to decrease the number and quantity of drops. And this medicine would be 1 drop once a day.
Oh, that's great. Now, is this online yet or in the testing stage?
It's not. It's in the clinical trial stage.
Okay.
One of the 2 medications that are up here on the screen has already gone through a couple of the stages, and they're still being studied. Now, at this point, it's more of an efficacy thing.
Okay.
There's a newer one that's coming out that's taking that current medicine, the Repressa, adding it onto a medicine that we already know that works to now give you a quadruple or 4 different ways of acting within the eye.
Oh, fantastic.
And that's actually one of the studies that we're involved with at Harvard Eye Associates.
That is great. Always a good thing that a therapy or a drop, whatever it might be, is coming and down very, very quickly. That, as you said, the quality of life is the main thing. And what I've noticed over the years interviewing yourself and the other great doctors from Harvard Eye is, as you said, Orange County, the epicenter of basically eye care and advances in medicines for your sight, that things have really progressed quite quickly. Obviously, you have to do the trials, but you're no longer maybe waiting 10 years for something now. Things are coming online much quicker, aren't they?
They are, and one of the fortunate things is these medications have been shown to work,
Yeah.
but they allow us to have access to give to our patients without it actually being available out to the public, and that's the part that's exciting for me. We're always on the cutting edge of providing good care for our patients, and this really allows us to do that.
That's fantastic. Good news. And if someone you're doing these trials right now?
Yeah, we're currently in the middle of those trials.
How would you find the proper candidate for that?
We typically will see them in patients, but also
Okay.
people who will see us on some of these different ways of doing it. They can simply call into our office and they'll be directed to our research arm and they can actually go through some screening questions. Really what we're looking for is people who have early glaucoma that are on multiple medications that are looking for a better way of doing things. And of course there's an altruistic value that goes to doing these kinds of things. You're helping other patients further down the line.
Of course, yeah.
But the other thing that it does, it provides a lot closer care for you because there's multiple visits that are involved that are typically covered and the medication's covered too.
Fantastic. Always good to see you.
Thank you so much. It's great having you here. Hopefully everyone will stay cool and drink a lot of water out there. It's hot out there.
And protect your eyes. Wear your sunglasses, right?
That's right.
Exactly. Hey, good to see you.
Good to see you too.
You
Thanks
take care.
again. Appreciate it, guys.
Dr. Teymorian-Harvard Eye Associates. We'll be right back.